gosh, can you imagine being told that you need to get surgery while you're pregnant? I mean, I can't even imagine being in that position. And today I'm interviewing a sweet mom that had to go through that surgery during pregnancy. Her story is that they found a cyst and they needed to operate to make sure that it's not cancer. And she got surgery just at week 15. Here's the deal. Pregnant women fall under the vulnerable population when it comes to clinical research studies, which means we can't ethically go ask a bunch of pregnant women to come join a study where we're testing out a certain drug to make sure it's safe for other pregnant women. I mean, can you think about that? Think about that for a second. It is just not ethical to test out drugs or procedures that we don't know how certain babies or moms will react. So most of the information out there when it comes to surgery during pregnancy or taking drugs during pregnancy is really based off of people that have already had this done, and they tried to compile the data to see how those women have reacted to that drug or to that procedure. So Elise was in a really hard position having to decide what to do with her surgery, and today we interview Elise and see how she has gone through the surgery and what happened next.
Can you see me yet?
No, I see a really cute picture of you.
Go now.
There you are.
Yay!
So sweet. Oh my gosh. I have a
right now, so.
Thank you so much for talking to me. I really appreciate it.
Yeah, I'm excited.
Yeah, me too. How old is your baby?
He is 6 weeks today.
I know. How's that been?
It's been crazy. It's been an adjustment for sure. Or no, he's 5 weeks today. He's 5 weeks because I go back in 6 weeks.
Okay, I know.
Yeah.
I was counting my maternity leave as well. I'm like, oh, I gotta go back in a week.
Yeah.
Thank you so much for joining. I just wanted to ask if you can just tell us a little bit about yourself and how's the adjustment been for you and whatever you want to tell mommies out there.
Yeah, so my name is Elise, and this is little Everett. This is our firstborn. He's 5 weeks today, and he was born on June 16th.
Okay.
So our pregnancy was kind of crazy. We found out at about 10 weeks that I had an ovarian cyst while pregnant. And we had to have surgery when we got into second trimester with him, and he did really good. We both did really good with it. But I was in a lot of pain from it, and I ended up losing 30 pounds from not being able to eat and being pregnant. It was really bad.
Gosh.
So the beginning of the pregnancy was really rough. This was my first pregnancy, so I really was not enjoying it. I felt like a horrible mom for not loving pregnancy, but
you're not the only one.
yeah. And so once I got into the second half, it got a lot better. We were able to, I was able to gain my weight back and things like that, but it was a rough start for sure, but he was totally worth it. And then let's see, the birth was crazy. So my husband's in the military, and he had to go help with the riots when I was 38, 39 weeks pregnant. So we weren't 100% that he was going to be at the birth for a bit, but he ended up being there in time, which was good. What other questions do you have?
Yes. So I wanted to ask, what symptoms did you have that made you go get checked out, or was it like a routine visit?
At 8 weeks pregnant, they found the cyst, but they didn't diagnose it. So the person that did the ultrasound saw it and noticed it and told the nurse practitioner. And the nurse practitioner kind of ignored it and said, "I think your bladder is full." And I was like, okay. And it turned out it was 14 and a half centimeters. So it was not small at all.
Oh.
And at 10 weeks, I was having a little bit of abdominal pain. And they said, okay, if you have some bleeding, then come in. Well, then I was at work and I had a little bit of bleeding. It wasn't a lot, but it freaked me out enough. And so I ended up going in, and they diagnosed it then.
Oh, wow. Okay. So were you in shock that you have to, did she immediately come out and say, okay, you're going to have to get surgery to?
So they left me in waiting for a while. I went to get the ultrasound at 10 weeks. And it was really scary. They didn't let me look at the ultrasound or anything, which, you know, it's a fun time to see your baby.
Yeah.
I was in a dark room by myself. It was very scary. And at the end, she came back after like 15 or 20 minutes of having the doctor look at this ultrasound and goes, so we can't tell you anything except that your baby is fine and we will have the doctor call you tomorrow. I was like, are you kidding me?
Don't do that to people. My gosh. Yeah. I hate that they're told not to say anything because they don't want to say something wrong, and then they become legally responsible for all that. And yeah, the whole legality of it all sometimes ends up hurting the individual, but really protects them in the long run, which don't even get me started on hospitals and their birth system and all that stuff.
Oh yeah. Well,
go ahead.
I was ready to have the doctor call me. She was supposed to call me at like, let's say it was 9 a.m. She calls me a little before and goes, we're actually going to have you come in. And I was like, okay. And so I like went in, and then she ended up telling me, that not only were we going to have to do surgery, but she wasn't confident in doing it. So she was going to start sending me to a cancer specialist in Chicago because she didn't think it was cancer, but she also had a possibility that it was.
Oh, wow.
So, yeah.
Did you have to go to Chicago?
Yeah, I did. So I saw the doctor, and she told me that she was going to do the surgery, and then I saw her again for the surgery. So I didn't have to go to Chicago a bunch. But it was nice to have someone that felt confident taking it out, but it was also scary to have them do it and not my local hospital.
Okay. So this brings me to, what did they, like, you know how it is with drugs or taking medicine when you're pregnant, you can't really take a lot of stuff because it's not really tested. So what did your doctor tell you about all the stuff, and did they have to put you under, and, did they have to take like any risks? What were the risks? Did they tell you, well, here are the risks, here's what might happen?
So they were more worried about me than they were about him, as long as if we got into second trimester. Okay. They said, wait a couple more weeks, you know, hold out, see what you can do, and then he should be fine. There is a risk with anesthesia, and we do have you sign a waiver, but we're pretty confident that he should be fine. We're more worried about removing an ovary from a 23-year-old.
Oh, okay.
So that made me feel better that, you know, I'm one that they were more worried about than him. I mean, that as a mom, I think you just kind of feel,
our instinct starts pretty early, our motherly instinct. So, wow, that's really hard to go through. I'm so sorry you had to do that. That's just so hard to just
surgery. So that was like, really, this is my first one while pregnant?
Yeah. So they had to put you under and all of that. You weren't even aware. Okay. I'm actually really curious about I would have to look into this, like what kind of anesthesia they used and what's safe on pregnant women. Like anybody that's watching right now is wondering, what kind of anesthesia can I use? What's safe, what's not safe? But you told the doctor and what are the risks, and they told you that. So I'm assuming that whatever they used is pretty routine and didn't really associate with any risks, or not abnormal amounts of risk, if you know what I mean.
Exactly. Yeah. So they felt pretty good about it. It was more of, if it's cancerous, we don't want to pop it essentially and have it leak into other parts of your body. And then also we don't want to have to take your ovary. So they actually gave me a choice. They said, would you rather us be more cautious and take your ovary in case it's cancer, or do you want us to go the way and try to take it out on its own? And there's two ways to do that. We could do it laparoscopically, or we could do a bigger incision. And it's kind of like a catch-22. We don't know. And I'm like, are you kidding me? I have to make this decision. But they helped me make the decision. So we ended up doing laparoscopic.
Okay.
And I would have woken up with a bigger incision if they were having a problem with it. But they ended up being able to get it out with laparoscopic and not bursting it, which was great. And it turned out not to be cancer, so that was fine too. So
there you go.
Yeah.
That's awesome. Well, that's great to hear. Are they telling you like to come in routinely so that they check on it, make sure that it doesn't come up again or anything like that?
Well, had a follow-up appointment with me, but we didn't do like another ultrasound or anything to see one. I may ask when I start going to my, gynecologist consistently to maybe do a couple routine checks on it, because you can be prone to cysts.
Yeah.
But this was a very large, clean cyst, so they think it came pretty quickly. So
okay. I want to talk about you're having to go to work, and then you said your husband's going to stay home, right?
yes,
You want to talk about that a little bit?
He's so excited.
You know what's so funny? My husband, when I had my first baby, I stayed home for 3 months, and then I asked my husband if he wants to stay home, because technically the fathers can do the same thing under FMLA, but they don't get paid. And then we're like, you know what? We have no other option. We don't want to put him in daycare. And like, do you want to stay home for 3 months? And he's like, yeah. And then he's like, oh my gosh. Because nobody like really knows how it is until you actually are doing the same thing every day, especially with newborns. Like they're getting fed every 2 hours, doing all that fun stuff. So he was like ready to go back to work afterwards.
Oh yeah. My husband wants to eventually, so my husband teaches self-defense training.
Okay.
So he eventually have clients be able to come to the house and train while he's having the baby there. So it also makes more sense for him to stay home because he can do that. I have to kind of more be in the office.
Okay, that's cool. And so is there anything you want to tell those moms out there that, if they're watching this video because they have to do surgery during their pregnancy, is there anything you want to tell them maybe to ease their mind about it?
Well, I would say that the doctors are not going to try to do something that they don't feel confident with. If they have to send you to a specialist, they're doing it because they know that it's going to be better for you and for your baby. Also, I didn't know this until surgery, but my specialist was not under insurance originally. I got a letter of, what's the letter called? Letter of necessity, so that my insurance would cover it. And that saved me thousands of dollars.
Okay. Those are good. Yeah. Insurance can get you if you're not. That's why I tell in one of my videos, I talk about how, hey, if you want to give birth, just make sure you're thinking of your deductible, because some people have huge deductible and then they're having to repay it again if they decide to give birth like January 31st. You're having to repay everything. Thank you so much for all this info. This is great info for anybody that's, about to go through this. So thank you so much, Elise. And you have such a cute little baby. I just like literally melt when I see babies. I tell my husband I can't, if I'm scrolling through Facebook and I see a bad post about a baby, I'm like bawling my eyes out, and my husband now like forbids me from doing anything like that. He's like, just don't go on those groups anymore. I'm like, I just can't do it.
No.
Yeah. Well, I hope you have an amazing rest of your maternity leave and enjoy it. Yeah, thank you again.
Your videos, they are so helpful. They helped so much before. I know. They just made me feel so much more confident.
Oh, I'm so glad. I'm so glad. Thank you so much. I'll let you go take care of them.
Thank you.
Bye. Thank you.